Can everyone hear me? Pound one. Let me just read. Oh, I can't hear you. Okay.
Hi, Ariana. I can hear you.
Okay, great. All right, let's get started. Okay. All right. Good afternoon. I'm Ariana Argandawal with the California Medical Association, and I'd like to thank you all for attending today's webinar, Integrated Healthcare Association's Statewide Provider Directory Project. If you have any questions during the presentation, please submit them through the question box in the control panel. It's located on the right-hand side of your screen. I will collect the questions and ask them at the end of the session. Earlier today, I emailed a copy of today's presentations. If you'd like me to resend them, please let me know by either using the question box or sending me an email, and I'll send it out to you immediately. Now I'd like to introduce you to today's presenters, Michelle Lewis and Raj Shah. Raj is the VP of Business Development at Gain Healthcare, where his primary focus is on healthcare organizations looking to expand upon master data principles and healthcare interoperability. Michelle is the Director of Marketing and Outreach at the Integrated Healthcare Association. And with this, I'll turn it over to Michelle. Michelle, please go ahead and start your presentation.
Okay, thank you, and welcome everybody. Thank you for joining. Can you see my screen?
Yes, we can see your screen.
Okay, great. So, as Ariana mentioned, I'm the Marketing Director at Integrated Healthcare Association. Today, I just wanted to talk to you about what we're doing with statewide provider directory utility. And Raj will go ahead and actually speak with you about the technology and the benefits for providers. So let me get to the next slide. Okay. So I thought I'd cover a little bit about who IHA is and why we're doing this project. Share our vision for what the provider directory utility, which we fondly call the PDU, what it will look like when we launch it, our roles, responsibilities, and what the timeline will look like, as well as the roles and responsibilities for health plans and providers across the industry. I'll tell you a little bit about how we chose our technology vendors, which, if you haven't heard, are Gain Healthcare and Availity. And then I'll transition a little bit to just kind of tell you what we've heard from the market in California about the provider directory data management problems and challenges, what the issues are, and then how we're thinking about approaching critical mass, so getting a large number of the California health plans and providers to use the provider directory utility. So that's what I'll cover today. So in this slide, I just wanted to, in case anybody on the line isn't familiar with IHA, we're a nonprofit 501c6 organization, and we've been around for over 20 years. We have a large number of stakeholders across the healthcare industry in California on our board, and so they guide us through the various different types of large-scale initiatives that we typically take on. And in general, our mission is to improve healthcare quality, costs, and really promote an integrated care model. So what we do typically falls into a couple of categories. You might know us for value-based pay-for-performance programs, which we've been doing for many years, and that falls into the performance measurement and benchmarking. And then we also do large-scale cross-industry projects, such as the provider directory utility, to improve the efficiency and really help out all of the different stakeholders across the industry. And the way that we do that really is by bringing all of the key people together through various different committees, and we're really known for making sure that the leaders across, like health plans, providers, purchasers, everyone involved kind of comes to agreement on how we want to attack these large problems. So we were actually, to give you a little bit of context of where this project came from, with the Affordable Care Act, as you know, a large number of consumers began signing up for healthcare and making healthcare decisions based on the inaccurate provider data that they were finding. So a lot of work over the years since then has been put into solving the problem, but we still see large challenges in pretty significant provider data inaccuracies. So actually, when Blue Shield acquired Care First, as part of that acquisition, they agreed with the Department of the DMHC, Department of Managed Healthcare, that they would solve large consumer problems in the industry. And one of them is the provider directory, by building a provider directory for the state of California. And then so Blue Shield got to choose an organization to bring this to life, and they chose IHA, primarily for the reasons that I was telling you about, that you know, we already have long-standing relationships with key stakeholders across the industry. And one of the things that is really clear about this problem is that it's actually an industry problem. So it's not necessarily a health plan problem or a provider organization problem. It's really just something that everybody needs to work together to fix. And so that's why our vision for what we want this to look like is one centralized platform. So you can see where we are today, which you might be familiar with, which is providers and provider organizations sharing data with health plans, but each plan is different and requires a different format and requires a lot of different things, actually. So it's been really hard on both sides, I think, to manage this issue. You can see it's clearly not an efficient way to do this. So the agreement across industry is really that a statewide centralized place for providers and plans to be able to get the data that they update and get the data that they need is the right solution for this. So I did want to clarify too, this is not yet a consumer-facing directory, so we need to focus. And first, we're focused on solving the problem of the data quality between providers and plans. So just wanted to clarify that, and also to show you these are the roles and responsibilities across the industry. So essentially, this is how it will work. Providers will be updating data and responding to the requests through the utility. So the idea is that there will be a lot fewer phone calls and requests for validations from the various different plans. Instead, there's just one format and one upload of data here to the centralized source. The PDU, or the utility, is responsible for validating and verifying that data, so taking the work out of health plans and providers to do that. And then plans are responsible for collecting that data and then also maintaining their own directories. So that's what happens with the data. Again, it's not consumer facing. It's provided back to the health plans so that they can populate their online websites and their printed directories. And the regulators continue to monitor the plans for compliance with SB 137, the law for directory accuracy. So that's the overview of what it looks like when we are done. I wanted to share a little bit about how we've set this up and what we're responsible for. So essentially, IHA is responsible for the entire project. We've built a governance structure which includes stakeholders, again, across the industry. So either in an advisory role or a decision-making role. And we're also responsible for the technology. So deciding on the vendors will be doing this, which we've done, and then also measuring and managing that the performance of the PDU. In terms of compliance, we're actually responsible for making sure that the product enables plans and others to meet requirements. So we're not the regulatory body, that's still the regulators, but we are responsible for building the product that enables that. And then of course we're responsible for all of the communications, marketing, and business development. And over time, this needs to become a sustainable business model. So it will be a self-sufficient utility. So you may wonder how we chose our vendor, and Raj will go into more about the advantages of the current product that GAIN has. But basically, it was a 7-month process where we did a number of different market research studies and landscape studies to figure out what the requirements were for this PDU. And so we found that GAIN and Availity actually were the best matches with our kind of extensive business and technical requirements. So we were looking for vendors that really matched what our requirements were, and this was actually vetted by our various management committees across the industry. We were also looking for a vendor who already had experience with California, so someone who could help us gain critical mass quickly, because we know that's going to be important to get a large number of plans and providers participating in this quickly, because it becomes more and more valuable with the more people who are participating and the more data that we have. And then obviously someone who had great customer reviews and a product that actually does improve accuracy, and great customer support too, because we know it's not just the technology that we need. We also need to address kind of what's happening within different organizations and help them kind of change their process to adopt this new centralized source. So this is essentially what the timeline looks like. So we are almost to the end of Q2, and so we spent the first quarter looking at the different proposals, selecting the vendor, and working on what the soft launch is going to look like. So now we are actually beginning the soft launch, and we have 3 large health plans already participating, and I have a slide later that I'll talk about that in a little bit more detail. But essentially the idea with the soft launch is to test the product, to have both plans and providers, a small group, help us test it out, figure out what needs to be developed, and how we can really address the diverse needs out there in California. So what we need to do to make sure that by the time we get to full launch, that the product is really able to provide what we need or what the industry needs. And so our plan is, and the important part of this slide is probably for you to know that our plan is to be able to launch this more publicly in 2019 and hopefully the early part of 2019. Okay, so I'll transition to what we've heard, actually, and I think this is helpful because when we are at conferences and we talk about this, I think both plans and providers are sometimes surprised to hear that what they're experiencing is the same as what the other organizations are experiencing. So this is pretty quick. I just wanted to give you a really high-level view of some of the things we heard, but basically both health plans and providers are saying that right now their current processes are really manual, and that they've put a lot of resources into this, and that sometimes in the millions in some cases per year to really solve this problem, and it's still, the data quality is still not what it needs to be. So both are saying that they're not getting, plans are saying they're not receiving data in the formats that they need, and it's very difficult for them to update their directories. And then providers are saying that they're working hard to get the data to plans in a way that makes sense for them, and that's not really working. So there's a lot of challenges on both sides. And additionally, what we heard about features from both plans and providers is that I can probably summarize this quickly just to say that there are a lot of different complex situations out there that this utility needs to be able to handle. So it needs to be flexible. It needs to be able to address all of the different complex contract situations that are out there, and it needs to be easy to use because, as we know, if things are difficult to use and not intuitive, it can be really hard to get people to remember to use it. So that's just an overview. The additional feedback we've heard across the board is that gaining critical mass is going to be really essential for this. So critical mass was defined by providers in our research as at least 3 major health plans, and of course a large number of providers as well. And that's important so that people don't have to manage 2 different processes within their organization. So you don't have the way it was done before and also the PDU. Instead, you have you know, sort of the majority of plans and providers that you need to work with on the PDU. And so we know that that's important to be able to get there quickly. And so to give you some a brief look into how we're looking at doing this, with our if we get 7 health plans and 3 of these are actually in the soft launch, then we're able to reach 50% of the addressable market on the plan side in California. And we have relationships with these different organizations already, and they're aware of what we're doing. So we have a good start here. We can get to 80% if we add on an additional 23 health plans. So, so we're looking at it this way to make sure that we can be pretty targeted about who we're approaching, to make sure we really get the right number of people on board quickly. And on the provider side, with just the organizations on our board, we actually cover about 50% of primary care providers and specialists. And so that will get us pretty close to at least a good start to critical mass. And then as well, Gain and Availity do have a significant number of California customers. So with the combination of those, that's where we'll start. And then we'll also have ongoing, of course, marketing and outreach throughout the year, throughout the next couple of years, to make sure that we can get to everybody within California who needs to know that this exists. And the way that we're doing that, in one of the ways, is that we partner with a large number of associations to be able to reach the audiences and educate people about this initiative. So this is just, I wanted to give you a quick overview of the soft launch. So we've got Blue Shield, Anthem, and HealthNet participating already, and we just started. And we have already identified and finalized provider organizations, and we are aiming here for a diverse group, so both large organizations, mid-sized, and smaller independent physicians, and in different geographies. So we want to make sure that we kind of had a cross-section of the industry. And again, the point of the soft launch is to be able to test the product, to get customer feedback, and to figure out you know, what additionally needs to be developed, and how successful we are. So we're looking forward to being able to share results towards the end of the year, hopefully around the November timeframe. We'll be able to share results of the soft launch and tell you more. So from here, I wanted to turn it over to Raj, who will give you more detail about what this product will look like and the benefits.
Great. Let me get my screen going here. Let me know if you guys can see that.
We can see your screen.
Great. So thanks, Michelle. This is Raj with Gain Healthcare. A little bit of background. We are a data management technology software company. We're based out of San Luis Obispo in the Central Coast of California. We've been around since 2007, primarily over the past few years, been focused in healthcare, providing solutions to health systems, health insurance companies, provider organizations, really around provider data management. So while we talk about the PDU and we talk about it in context of what we're doing today in the soft launch, I do want to make sure I give you a little bit of the history and a little bit of the philosophy by which we built our platform on, because it's all very relevant to where we plan to go with the PDU. And part of it is we, as Gain, had a product and have a product called Sanator, which is a provider registry product that actually we launched back in 2016 when the state legislation around SB 137 went into effect. We actually got involved into the whole provider directory and data management space through many of the large provider organizations via American Physician Groups, APG. So we have built this platform and have been running it in a production setting for the past few years. And so while we are, again, talking about the soft launch, there is a lot of history and a lot of material that we've built up over the past few years that went into us becoming the PDU solution with Availity and IHA. And I'll try to talk a little bit more about that as we get through this. First of all, I think it's important to understand sort of our mission statement. And when I say our, I'm really referring to things in context of Gain, Availity, and IHA. And so one of the biggest things that we've said from the start was we are really in the business of making healthcare really more efficient. The processes and the things that are in place today are very cumbersome. There's a high administrative overhead for providers and provider groups and for health plans. And the reality is, with the way the legislation is, with what we're trying to solve with provider directories, we really need to have a good process in place. And I think that when we look at how we are improving healthcare, our philosophy aligned well with what IHA and Availity believe as well. And so it was really important for collectively our organizations to come together. And our goal is really to try to connect the operational systems and processes that exist across the marketplace so that we can help obviously reduce admin, but also help with improving data quality. And a big part of our philosophy, which is very important to you, the provider, is that we really want to help avoid overhead to you, but also become a trusted partner. So we're very, very keen on things like privacy, data privacy, and our policies amongst all three of our organizations are really central to that point. And so as we talk about this, we'll talk more about how does this impact you as the provider and what does that mean. But at the end of the day, we really are about transparency and visibility into a process. We're really about a quality product that ultimately is going to help serve the community, the marketplace, the provider groups, clinics, FQHCs, health plans. All of these folks are participating in this centralized process because it really needs everyone to come together in order for us to help solve the problem. So as I said, we've been around for a while now, so we've got a lot of history about what's happened in the marketplace since something like SB 137 came out. You know, we had predicted early on in 2016 that this legislation was, if anything, going to drive more outreach. So you as the provider are getting phone calls and faxes and a lot more outreach to your offices, to your admin staff, to your front office staff, asking to collect more data, to validate more data, to reconcile spreadsheets, to fill out fax documents. All that was happening as a reaction to legislation, both state and federally. And we knew that just because there was a lot more outreach happening, that didn't necessarily mean that things were going to improve. If anything, what we've seen through audits and through case studies by folks like CMS is that the data quality is actually getting worse. So we're putting in more money, we're putting in more effort, but we're not improving the problem. And the reality is that until folks look at the underlying processes that exist amongst the plans and the groups and the providers and really figure out the root problem, we're really not going to improve the data quality. And so our model was designed around the fact that we don't want to just be another vendor who's calling your office location to collect data. That's really not what we do. And as I talk through our solution and what we're putting in place for the PDU, it's important to understand how that fits in to your workflow and that how this is going to ultimately reduce the additional outreach attempts, the phone calls, the faxes, because we're going to integrate everyone into a centralized model. And we put this quote up here for Albert Einstein because it really is true. You know, with the marketplace, it really was insanity because everyone was doing things over and over and over, expecting that the data was going to get better, and it really didn't. And I think now, having gone through this for a few years, we're very keen to the fact that the processes that exist aren't working, and we're trying to build something that is sustainable and that can be used in the long term, and while at the same time improving quality and reducing admin. So the very first thing that we kind of go after is that there really is no single point to collect all the data relevant to a provider and the contracted relationships that they have with their provider groups and with their plans. And so when you think about that, it's important that you understand that we had to put together a model and a platform that understands that your data as a provider doesn't just live with you, but it lives in all these different systems out there. If you work with provider groups or MSOs or even plans, they all have versions of the data that exist about you as a provider. But the important thing is being able to put together a model and a structure that can deal with that level of detail, the contractual level of detail that exists amongst the marketplace between providers and their plans. And when you look at California in particular, it's a heavily delegated model. There's a lot of large provider organizations that exist in California. There's obviously a lot of health plans. And the reality is that when you look at a provider who may participate with a group practice, who may contract with an IPA, that IPA may have another relationship to, let's say, an MSO. You as a provider may have a direct PPO contract with a plan, and that plan may rent out that network to another plan. So when you start looking at the topology of California and the way these relationships exist, going back to my previous point, the thought process that we could just call up your office staff and ask, can you explain this level of detail? It's a flawed thought process. What we really need to do is we need to take these various endpoints, all of these different groups and people that deal with the information around a provider, and we need to integrate them. We need to centralize that model. We need to have it be collaborative, and we need to have workflows and ways of being able to tell all these different endpoints what's happening with the information. Where are we in sync? Where are we out of sync? How do we get consensus on certain pieces of information? And in some cases, that piece of information may be related to a very specific contractual relationship, at which point we also need to know who are the right people to contact when it comes to verifying certain pieces of information, because as a individual provider, you may be contracted with an IPA who has an HMO contract to a health plan. Well, that IPA is half of that signatory on that contract along with the health plan. So the responsible parties now become the group and the plan, versus you as a provider maybe having a PPO relationship directly with the plan, in which case you are responsible for certain pieces of information between you and the plan. So just getting that understanding and being able to dive into that level of detail is really a core part of our data model. It's also part of our philosophy and our platform. The other thing that we knew was happening is that the health plans had to put together their own processes to be compliant with the regulation, both state and federal. And the reality was that every plan came through with their own process, and then you as a provider are now having to react to the various processes that exist in the marketplace. You may have to go to multiple portals, and you may have to deal with multiple outreach attempts, all to collect a lot of the same information, because there are all of these different processes. And the reality was that the marketplace wasn't going to align with any one particular process by any one particular health plan. The reality was that we really needed to establish almost a third-party centralized model. So what we're bringing with the PDU is really a collaborative platform that allows all of the various stakeholders to participate in the centralized model, understanding that each plan still is going to have their own process. And so within our model, we're dealing with all of those various downstream processes for the plans, but to you as the provider, we're providing you a centralized hub, a centralized gateway to manage your information so that we can sort of shield you away from those various processes downstream. We as the PDU are able to handle that process. And so for you as a provider, it's really about how do I get a centralized place to go to manage my information for all of my contracted health plans and provider organizations. So as I mentioned, we've been doing this for a while, and I want to give a little bit of history. So the Sanator Provider Registry was a product that GAIN had put together. It was this collaborative data management platform, heavily used by large provider organizations throughout the state of California. That is the base for what we are putting together for the PDU. So it is the base technology data management platform that is becoming the California statewide provider utility. In addition, we are working and collaborating with Availity, who also bring to the table a provider engagement portal, which is really a multi-payer platform, and it's used by a lot of individual providers for a lot of various functions that Availity provides. And so between GAIN and Availity, our goal is to be able to provide a front-end platform that meets the needs of all the different people involved, but also brings the back-end data management technology that's really necessary for the proper management of this information amongst all these different constituents. And so as a part of that, we have garnered quite a bit of support and participation from a variety of health payers as well as provider organizations throughout the state of California. It's a big reason why I think for groups like IHA, when they talk about critical mass, this is a very important key, is that we've got 2 years, over 2 years of building up this provider registry model with all of these different endpoints already plugged in. And with Availity, very similarly, they have these health plan relationships that allow them to deal with a lot of the small provider practices throughout the state of California. So we're able to now get at the various types of providers that exist out there, everything from the individual all the way up to a large MSO, all the way up to a health plan. So let me talk a little bit about the model that we put together. So we are really about integration. We're an integration platform. And so in our model, we are plugging together individual providers, health plans, provider groups. We leverage certain sources of information that we refer to as reference sources for the purposes of validating some very specific data fields, and association groups. So groups like the CMA and APG are all association groups that work with providers, that deal with data, they deal with interactions. And so our goal is really to plug in all of these folks into this collaborative model. It helps reduce the admin across the board because we're doing things centrally. So as standards change, as the needs change for the regulator or for federal legislation, we're able to do things in one place so that everyone that's plugged into this process gets the benefit of that technology. And we're not dealing with silos anymore. We're not dealing with every plan and every group having to change processes individually. We're doing this now centrally. And as a part of that, we're very, very keen on privacy. So amongst the people participating in this PDU solution, we're very, very clear about not selling and sharing data outside of the folks that need to know about that information within this model, and that folks like you as a provider are aware of how your data is being used in this process. Right now, I think there is a lack of knowledge across the board about what are all these requests that you're getting to fulfill, right? When you get a data collection request, who is that for? What is the purpose of that? What is your information going to be used for? And then oftentimes, you don't necessarily realize that that data you're supplying may end up in the arms of third-party vendors, pharmaceutical companies, DME companies, all of which will contact you and try to get you to do other things and participate in other projects and buy their products. And for you as a provider, you really want to know that this model, that this platform is doing what we say it's doing. It's sharing your data with your contracted groups and plans for this very specific purpose, and that you're not all of a sudden going to find out that your data is being shared externally with other entities. And as a part of that overall model, we already have, while we are talking about this in terms of a soft launch, we do have a very strong baseline of providers through provider groups and health plans already participating in this centralized model. We work with many of the large provider organizations throughout California. We've got multiple health plans plugged into this process, and with the soft launch, we're adding the additional folks of Anthem and Blue Shield and HealthNet to the mix. So we're getting, when we talk about critical mass, we already are starting with a very, very strong footprint before the soft launch even began. And so the expectation is that through the soft launch, we'll be able to demonstrate what we've been doing for the past few years, but with the larger plans in California, with the expectation that we're going to continue to bring on additional folks so that we get to that critical mass that IHA was sharing earlier in those slides. And through that, we work with a lot of the medical groups, small clinic practices, with the Availity portal as well. A lot of providers are engaged in that process. So they may already be familiar with some of the tools that we're providing for the PDU. But at the end of the day, we have well over 80,000 providers participating in this process, whether directly or indirectly. And so we're already at a point where we've got a very strong following. We understand where the pain points are across the marketplace. And so the centralized model was the basis for what the PDU ultimately is becoming. So we talk a little bit about the value proposition as it exists across the marketplace, and then more specifically what that means for an individual practitioner. So when we built our model, and now the PDU model, it's important to understand that there's no sort of one silver bullet for fixing this across the marketplace. Depending on who you are, you get different value out of different parts of this product. And if you're a health plan, your big thing is being regulatory compliant. You've got, as a health plan, multiple systems internally that you need to reconcile with all this data. You need to be able to consume data from portals and files from groups and from individual providers, and you need to make sure that's maintained and it's done so regularly. With the way that the legislation is, they have some very specific timelines for when they're notified of a change to make sure that that propagates itself to the online directory for the consumer. So they're really focused in on those pieces of this. And if you're a provider organization, you're oftentimes looking for the tools necessary to manage this type of data, because internally you may not have the right systems that can truly manage this type of detail. A lot of times what we see is provider organizations or groups are using a system like a credentialing system for the purposes of provider data management. It's important that folks understand that those systems aren't for that purpose and that they're actually trying to be customized for that. And we're providing a tool that allows them to manage this externally of those systems so that they don't have to customize or change things internally. And they also want to be able to deal with the distribution of that data to their contracted plans. And so that process, when you're a provider group, is a very old, archaic process. There's a lot of Excel spreadsheets being handed around, and part of what we're bringing to this model is how do we do this more electronically in a way that's going to reduce some of that admin. And then for the small practices, the smaller practices, for the individual providers, a big part of this is, one, really having a truly trusted utility, a trusted portal where you understand what information are you capturing, how are you using my data, having that transparency and that visibility into that process. And then being able to do it through one place so that it deals with all of your contracted relationships. You don't want to have to go and update your demographic data in 10 different portals and have to manage it all separately. You want to be able to do that in a single point, and be able to have visibility into your contracted relationships across all of those plans. So being able to see that level of detail. So I'm going to dive into a little bit on the technical side. I'm going to try to keep it at a fairly higher level. First, I just want to talk about the architecture of the PDU. When I talk about this term PDU, it's important to understand what are really the components that make up this product. So first of all, if you kind of work your way left to right, you can kind of see that as a doctor, your engagement really begins with the portal and being able to create and manage a profile of information at the right level of detail. But then from there, there's some additional components that exist for us. There's really what we refer to as our registry, which is really the data management piece of the back end. We also are facilitating workflows between provider groups and plans when it comes to these larger data exchanges, oftentimes referred to as a roster of information. And then there's this whole formal process that now exists because of SB 137 and some of the regulations with CMS around regular attestation processes. So this concept of a formal verification of information between two contracted parties, whether that's the plan and the provider or a plan and a large provider group. So we have tools that allow us to present and go through that type of information. And then on the back end, on the back office side of things, really what we have is we have all of the components that allow us to truly manage this information. Everything from plugging in reference sources of information, having data stewards be able to review information, ensure data is lining up appropriately, and then really just having that day-to-day operations that facilitates the exchange of information on a regular basis amongst all the people that need to know about that data. From a front-end perspective, as a provider, you kind of think about the things in terms of, I have a contract with a group or directly with a plan. And so the goal is for how do we take your workflow of what you have contractually and plug it into this architecture in a way that's going to streamline the work for you and not actually add more to your workflow. So as an individual provider, really the big thing to understand in the set of tools that we provide is that you are able to create or even update your profile. You're able to see your profile, be able to view your information, see how reference sources align with your data, help validate certain things like your state license information or your personal NPI number. And then from there, really being able to understand the contracted level relationships that you have amongst your provider groups and your health plans. So that level of detail oftentimes is not presented when you look at certain portals. So having that all be centralized, having a one place for you to go to review all that is extremely critical in this model. From a regular day-to-day perspective, I think it's also important for you to understand, what does this mean for me? What is my role in this process? And the reality is, day-to-day, you being able to manage your profile, being able to see those contract relationships is obviously very critical. But what's another key about this whole process is we're also plugging in data from the plans and from the groups. And your profile exists in all these different places. So you as Dr. Johnson have your own view of your data, but so do everyone else. And within this centralized model and this process, we're facilitating a way for you to be able to get visibility into that, to know when you are in sync with a health plan or when you're not, and being able to notify you and give you a workflow to understand where those discrepancies exist, because that's the way we're going to start getting consensus on information, is being able to tell all the parties involved with that particular provider where they're in sync, where they're out of sync. In some cases, it's contract specific. So the only people that can truly validate that piece of information are the two signatories in the contract. And so getting to that level of detail is really critical. I think as a provider, you want to be able to go into a portal and see that level of detail, manage that day to day, so that when it's time to do those periodic things like an attestation, you're not having to essentially reinvent the data, right? Send all the updates again to a plan. You want to know that it's being managed from a day-to-day perspective, so that when it comes time for those periodic reviews, really the data should be aligned because we've been managing it from a regular perspective. And it's not just, hey, we've called you once a quarter to try to verify information. We need to get this to be more of a day-to-day perspective. And so really the key for the overall PDU is providing you the tools necessary for you to manage your information at the proper level of detail, being able to provide you visibility and transparency into this process, and overall really helping you reduce the admin by leveraging these tools and the resources that we're bringing to the PDU via IHA, GAIN, Availity, and all of our other partners who are providing specific services for this process. You as a provider get to leverage all of that work that's being done so that you don't have to go and find another avenue to do so. How do you stay involved? I know Michelle may have talked about this earlier, but for folks who aren't aware, you can go to providerdirectoryca.org. There is a website there. IHA are hosting that, and there is a lot of information available. There's some FAQs, additional info about timelines and what we're doing. You can also feel free to contact me directly. Happy to answer any questions folks have. But other than that, I think we're set, and I think we've got time for some Q&A.
Yeah, can you hear me? It's Michelle again. Thanks, Raj. Okay, great. Thanks, Raj. So yeah, I just wanted to put in, again, what you can do right now is to go to the providerdirectoryca.org and sign up. We're planning on doing regular communications to make sure that everybody who's interested knows where we are and what's happening. So I'd really suggest that you do that also. And I think Ariana is going to put up my contact info as well. Yeah, there we go. So if we didn't answer anything during this call, if you have thoughts afterwards, we'd love to hear it either through that website. You can go there and just fill out a message for us, or you can contact us directly. And we'd love to hear what you're thinking and your specific challenges. So thank you for listening.
And we do have a couple of questions. The first one is, what plans are working for the soft launch?
Yeah, so that would be Anthem, Blue Shield, and HealthNet are working with us on the soft launch.
Okay. And will the California Medi-Cal managed care plans be asked to participate, such as partnership health plans? Yeah,
so we're designing the PDU for managed medical plans, and we're working to bring all of them on board in 2019. So for sure, and then also some of the soft launch plans and providers have managed medical business, so we're testing that as well. And Raj, did you have anything to add to that?
Yeah, I would say that it's absolutely true. This PDU is helping deal with SB 137, Medi-Cal, and Medicare requirements. In some cases, within our existing footprint, we already deal with some of the Medi-Cal managed plans, but our goal is to get participation from all types of plans, regardless of line of business.
Yep, so everyone in California. That's the goal.
Great. There's another question. How do we become participants?
Yeah, so the best thing to do right now is to send us a message in one of these messages here on the screen. We currently have we wanted to keep the soft launch kind of manageable so we can test, but we're moving fast and we want to expand as quickly as we can. So if we know that you're interested, that's really helpful. So if you can sign up in that way and indicate that you're interested, that would be helpful. Is there anything else I'm missing there?
Yeah, so the other thing I'll put out there is if you are a provider who's also contracted with a provider organization, whether it's an IPA or you have an MSO, even a smaller medical group, it's always really important to make sure that you let those folks know and become aware of what we're doing. We are obviously trying to reach out to those folks as well. But if you are with one of those groups, even though we are in the soft launch phase, it's not stopping us from bringing on additional groups into this process. So we do want to speak with any groups that you may be contracted with who are maybe not currently participating in this process. And you can feel free to reach out to me. I'm happy to engage with your provider group. As far as the individual providers, I think we're planning that rollout, and I know as we get through the soft launch, you'll get more information on how you can continue to participate.
Okay, we have a question from Susan who wants to know, how is this project funded?
So it was actually, I had mentioned the Blue Shield Care First acquisition. So when that happened, as part of that acquisition, Blue Shield committed to DMHC and the healthcare industry to improve things for consumers in California. So it's actually Blue Shield's committed to a 5-year contract with us to bring this to life, and then after that, during that, we are working to make it self-sustainable. So there would be a cost to participate, but we are, definitely aiming to make that cost be not a barrier to participating in it. Hopefully that answers your question.
Yeah, and maybe just to add a little bit to that as well, the model in this, by doing this as a kind of a centralized registry type model, is that all the endpoints, all the people participating, pay to participate, but it's all, related to the size of your organization. If you're an individual provider, it's really about you, and so your management of your information within this process is not meant to be, as Michelle said, a barrier to you participating. And I think as a goal of this, while we have funding to get through things like the soft launch and start to build up the model, the goal for us is to create this sustainable model long term. As GAIN, we've been doing this now for a few years, so we're familiar with where the pain points are when it comes to things like cost, and where does it become a barrier. And I know as we work with IHA and Availity, those principles will take effect in that.
Okay, Stuart has a question. Will you be able to upload via Excel files on provider information?
So it depends. I think it depends on who you are. If you're coming at it, so as I mentioned before, there's kind of different ways folks interact with this process. On the back end side of it, we do take data files today. We take them in Excel. We take them as text files. It can vary depending on who you are and how you store your information. So as part of our bringing on, let's say, a provider group or a provider organization, we work with them on that data exchange process, and there's some very specifics around the details of that. And we do that with the plans as well. So as part of soft launch, we're demonstrating that right now with Blue Shield, Health Net, and Anthem about how do we consume that data. But yes, we have the technology for that. There is a process for it. And depending on who you are, we would want to work with you on establishing that routine process.
Okay. Another question is, what is the role of the large provider organization in this project?
Yeah, it's actually a very, very critical role. I oftentimes think that the provider groups are a forgotten set of folks in this process. A lot of times people think about it in terms of the individual provider and the health plan, and they forget there's this whole middle ground about provider groups. And in California, there are hundreds of large provider organizations that represent tens of thousands of providers. And in some cases, providers participate in multiple IPAs and provider groups. So it's really important that they be plugged in just like a plan, because they're oftentimes dealing with a lot of the management of the information of the provider. It's why people go and get MSOs to help reduce their admin and outsource some of that functionality. So we oftentimes see that they are can be a great resource of information, and they've got a lot of processes in place that need to be accounted for. when we're talking about the interaction of data, because a lot of the data really lives with them. And if you're delegated for credentialing and other functions, they're really a critical source of that information. So making sure that we get that large provider groups involved is very important, so that we truly have the overall view of a provider across all of those relationships.
Okay, there's a question from Veronica. Who will validate the information submitted to the PDU? I'm sorry, who will validate that the information submitted to the PDU is true and correct?
That's absolutely a great question. I'm going to go into a little detail here. I don't want to spend too much time because I know we're coming close to the end, but at a high level, when it comes to data accuracy, we actually look at it more about data quality. And data quality is truly about demonstrating a process against a set of policies for all the data, for various data fields. A lot of times that can be forgotten about. People think and they look at provider accuracy as some percentage number. That's not the way to look at it. That methodology is flawed. You really want to look at, for any one particular data field, what is the policy that we're trying to adhere to, and then measure against that policy. And so as we get data, depending on what it is, there can be a source of truth. If it's got, like something like a board certification, there is a place to go, like ABMS or AOA, to validate that information. But there's other things that do not necessarily have a reference source of truth. And it's really coming down to contractual level details that exist between two parties. And so then it comes down to understanding what are those contracted relationships, what are the terms under those relationships. And so when changes are made, we can then, between those two parties, figure out, do we have consensus amongst that data? So there's a lot of different policies and different things that have to happen depending on what data field we're talking about. But understand that one of the things that we're doing in the soft launch is documenting what are those policies, what are those metrics we're going to be capturing against, measuring against those things, so that by the end of the soft launch, we can demonstrate how we've improved the data quality and what did that process look like.
There's a question from Cindy who wants to know, Medi-Cal plans assign patients to clinics under FQHCs. Will you be entering clinical information in this database?
So the short answer is no. This data is really boiled down to the information needed to manage provider information for the purposes of like an online directory for a health plan. There are some additional fields that we capture outside of what may get published in the directory, but we are not dealing with clinical data.
Oh, it's clinic data, not clinical.
Oh, clinic data. Okay. So yeah, for things like an FQHC, obviously very important to this process. Even during our soft launch, we have some FQHCs participating. So we understand that the clinics are an extremely important part of this process, but also that the clinics have the challenges because you have a lot of churn in who's at that clinic at what day, and it changes so frequently. So this is why the day-to-day processes are really, really important, especially for a clinic location that has high volume of changes on a regular basis. So we will be demonstrating that during the soft launch.
And for our last question, where do you see blockchain coming in to aid in the data exchanges, i.e. contracts versus demo data versus credentials?
I was waiting for the blockchain question. It seems to come up often nowadays. So our technology is very specific. We have a long history of what we've been building into the platform. The founders of the company have been doing this for 20 years, so they understand the complexities of data management. When it comes to things like blockchain, I think it's about where does that use case fit into the model. I think a lot of people think that technology alone is going to solve the problem of provider directory accuracy, and the reality is it's not. What it's providing is an additional utility or tool that can allow for more secure exchange of information amongst these parties. But I think in our model, we're to some degree already demonstrating a similar level of capability With things like blockchain, we'll certainly look at how the marketplace utilizes that technology and what scope they put it into. And if it makes sense to plug it into our process, we would look to do so. But I think we've got a good, sustainable model with the right technology amongst the companies that are participating.
All right, that's all the time we have today. I'd like to thank Raj and Michelle again for their time. And we've recorded this webinar, and it'll be available for viewing in the next couple of days. I'm going to send out an email with the presentation link as soon as it becomes available. And as soon as you close out of the webinar, a short survey will pop up. Be sure to complete this survey in order to help us improve future webinars. All right, thank you, everyone.
Thank you.
Thank you all.